Assalamualaikum warahmatullahi wabarakatuh. For this BIO310 case study, our group will explain about the topic of anemia. Let's start this video by introduce our members for this group. So the first presenter is me, which is Nur Aida binti Magdalene. My student ID is 2020 464886. The second presenter is Ajina Nazira binti Azadi. Her student ID is 2020 817 958. The third presenter is Amira Shafika binti Abdul Nasir. Her student ID is 2020 476 342. The fourth presenter is Nurul Fahana binti Shukri. Her student ID is 2020 487 918. And the last presenter for our group is Nur Najwa binti Muhammad Ramadan. Her student ID is 2020 610 684. So I will explain more about the introduction part in this video. The definition of anemia is the amount of red blood cell and hemoglobin is not enough or decreased. Low hemoglobin will make someone quickly get tired when doing some activities. Anemia can happen for some reasons such as blood cell, decreased red blood cell formation, and also destruction of red blood cells. Firstly, blood cell, or we call as hemorrhagic anemia, can be one of the causes for anemia. This means when someone got bleeding, the blood can lose a lot, and this happens slowly over a long period of time. This can happen to a woman's period, especially if have menstruation. Sometimes it also can relate to fibroid. Next, anemia is caused by decreased red blood cell formation. This happens when there are something wrong with the red blood cell or don't have enough mineral and vitamins needed for red blood cell. Conditions associated with this cause of anemia are iron deficiency anemia, sickle cell anemia, the deficiency of vitamins such as B12, and bone marrow and cell problems. Destruction of red blood cell is happen when red blood cell burst, and this is called as hemolytic anemia. This condition might happen to the person when at birth or even can come later. The causes of hemolytic anemia is attack by your immune system, enlarged spleen, but this is very rare case, toxins from liver or kidney disease, and something that strain your body such as illnesses or medications. Anemia disease contains its own symptoms which can interfere with a person's daily activity. The symptoms of anemia are fatigue, paleness, and shortness of breath. It occurs when your organs are not receive the nutrients they are required in order to function properly. If people want to get diagnosis for anemia, they need to do some tests, which is blood smear for checking the shape of red blood cells and find the unusual cell. Reticulocyte count is a test to check immature red blood cell. For the treatment for anemia is firstly taking medication to hold back the immune system. If there are a lot of blood loss, maybe they need to have surgery to fix the bleeding. Taking iron supplement is also one of the treatment too, especially for those who have iron deficiency. So I will explain the next part, which is the problem statement. The problem statement for anemia is you want to know whether people nowadays are aware about anemia disease or not. Anemia is one of the diseases that people don't really give attention to it. Thus, our group was doing research in order to find out whether the respondent and their family members they have anemia or not. Factors have become a problem too. Why people can get anemia disease? We need to figure out the frequent symptoms that maybe will affect the life of someone. It is really important to know the symptoms because sometimes symptoms can make some people cannot freely do their daily routine as usual. Type of anemia must need to identify because we want to know which type of anemia is become common. And for people who have anemia, maybe they don't know which the best treatment and the prevention that they are really needed.
Assalamualaikum warahmatullahi wabarakatuh. My name is Ajina Nazira binti Azadi. So I will explain about the objective for our case study. So for our case study about anemia, there's 6 objectives, which first to determine the level of awareness about anemia among the general public, second to figure out the amount of anemia among respondents and their relatives, third to determine factors affecting the severity of anemia, to recognize the most frequent symptoms and how it affects a certain lifestyle, to identify which type of anemia is common in society and what it is caused, and the last one, to identify the common treatment and prevention of anemia disease.
Assalamualaikum warahmatullahi wabarakatuh. My name is Amira Shafika binti Abdul Nasir. So for this presentation, I will be talking about the methodology that we took in order to conduct the survey. So first off, I will be talking about the platform that we used to conduct the survey, which is Google Form. The reason why we chose this platform is because it is a user-friendly platform that allows us to be able to conduct a research and receive responses from others, and it is also a very common platform when it comes to conducting surveys. So for our target respondents is that it is open to all ages and genders among UiTM students. The questionnaires, the questions that we asked for the people who had answered our survey. First off, we started with some personal information questions such as their age and also their gender. And then we also asked personal questions about anemia, such as do you know what is anemia? Do you suffer from anemia? And also, what do you think is anemia? Next, some of the questions which are more in-depth regarding anemia, such as what do you think are the symptoms of anemia? Which of the following is the best treatment to treat anemia? What are the causes of anemia? And how to prevent anemia? And lastly, this is our conversation with one of the respondents that actually suffers from anemia. We asked regarding about how did they first know when they had anemia, and also we asked about the treatment that they seek for in order to cure the anemia and reduce the symptoms of anemia. So that is all from me. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. So for today, I'm going to be interviewing one of our respondents to ask her about anemia. Can you introduce yourself?
Okay. My name is Atifa binti Azwa. I am part 5 student in Diploma Applied Science.
So when did you first realize that you had anemia?
When I feel dizzy in hot days and I would vomit.
So what were the symptoms of anemia that you had?
When I always fever in the evening.
What did you do to cure your anemia and reduce the symptoms?
Okay. First, I consult a doctor and consume iron supplement.
So that is all from us today. Thank you very much for your cooperation. Assalamualaikum warahmatullahi wabarakatuh.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nurul Farhana. I will present about result of the case study. Firstly, the survey that obtained from the Google form, we can conclude that most of our respondents are female, which is the percentage is 66.7%, while for male is only 33.3%. Other than that, most of our respondents age between 18 to 23 years old, which of the percentage is 66.7%, followed by 30 to 36 years old and above. Next is the pie chart show the people that know about anemia are 83.4% and only 60.7% people did not know about anemia, while most of our respondents say that they did not suffer from anemia, that the percentage are 63.3%, followed by 36.7% people that suffer from anemia. Next is about 93.3% people say that anemia is lack of red blood cell. Next is the symptom of anemia state that 50% say that all of the above is symptom of anemia, and 36.7% say that fatigue is a symptom of anemia. And for the treatment, about 93.3% respondents say that consume iron tablet under the doctor description is the main effective way for treat the anemia. The cause of anemia are low level of hemoglobin, that the percentage is 30.3%, same as heavy menstrual cycle, except for the mutation of white blood cell that the percentage is 70% because it not the reason of get the anemia. Last but not least, the way to prevent the anemia is by eat iron-rich food, which are the percentage of it is 53.3%, followed by all of the above, which is 14%.
Hi, Assalamualaikum. My name is Nur Najwa binti Muhammad Ramadan. I will continue to the next part, which is discussion. From the result of the form, there are 63.3 of the respondents who do not have anemia, while 36.7% of them is having anemia. According to the study, 42% of anemia is children who is less than 5 years old, and there are 40% of anemia is a pregnant woman. So, when we talk about anemia, do you know about it? There are more than half respondents who already know about the anemia, but let me just explain about it. Anemia is a decrease in the amount of the red blood cell or the amount of hemoglobin in the blood. Hemoglobin. What is hemoglobin? Hemoglobin is a protein of the red blood cells that carries oxygen to body's organ and tissues and transport carbon dioxide from organ and tissue back to the lungs. So, the people who suffer anemia, they have low hemoglobin in their bloodstream, and the tissues and the organ of the body of anemic do not have enough oxygen because the hemoglobin is at the lower level. Next is cause of anemia. One of it is blood loss, for example, heavy menstrual cycle. Then is destruction of blood cells, low level of hemoglobin, and abnormal hemoglobin. I will explain more with their type of anemia. Next one is type of anemia. The first one is iron deficiency anemia, where the insufficient iron results in fewer hemoglobin molecules in red blood cells. The second one is aplastic anemia, which is the bone marrow does not produce enough stem cells. Next is hemorrhagic anemia, the extreme blood loss during injuries, bleeding, ulcer, malaria, and so on. Next is pernicious anemia, the deficiency of vitamin B12 absorbed by the digestive tract. And the last one is sickle cell anemia, where the red blood cells become sickle-shaped when oxygen concentration is low. Next one is symptoms of anemia. Symptoms of anemia is pale skin, headache, fatigue, dizziness, short breath or difficult to breathing, and insomnia. For the treatment, iron deficiency anemia is mainly treated with iron supplement, intake of a diet which high in iron, and in some cases, iron is also given through IV infusion. For the treatment for aplastic anemia, include bone marrow transplant, blood transfusion, or medication. For pernicious anemia, the intake of folic acid supplement can help in folic deficiency anemia treatment. The vitamin B12 is administered through the injection. And for the treatment of the sickle anemia, it involves the intravenous fluid, oxygen therapy, blood transfusion, and pain-relieving medication. The hydroxyurea is an oral medication which can increase fetal hemoglobin and make red blood cells bigger. A bone marrow transplant is also a treatment option to cure this type of anemia. And the last one is prevention from anemia. We can practice the dietary high in iron such as red meat, eggs, oat, cereals, and so on. Next, we can consume foods with high amount of vitamin C such as fruits and fresh raw vegetables. Then, take vitamins that contains iron which can increase the iron in the blood. Beetroot juice also acts as a great blood builder. They rich in folic acid. So all of this is the effective prevention from getting anemia. That's all from me. Thank you.
So the last one is conclusions. So for conclusion, we have collected 30 respondents by using Google Form as our platform, and we can say that anemia is a common blood disorder. It happens when we have fewer red blood cells than normal, and when we have anemia, our blood can carry enough oxygen to body. So without enough oxygen, our body can work as well as it should. So the causes of anemia: first, blood loss, destruction of red blood cell, low level of hemoglobin, and abnormal hemoglobin. So we can prevent from this disease by dietary sources: vitamin C, iron, and beetroot juice. The treatment for this disease are iron deficiency anemia, treatments for plastic anemia, and vitamin deficiency anemia. So in the study, all of the objectives we had for conducting this survey was successfully achieved. And that's all from us. Thank you.